Yes. Good afternoon, good evening, our viewers and our subscribers. Today we want to talk about another one, very important topic, and this affects our population. Statistics say 25% of us, of all of us in the population, 25% of us have this problem, and that is halitosis, bad breath. The bad breath from the oral cavity and nose. Bad breath is not something pleasant, and people are always having a question, inboxing us, what is the cause of bad breath? The good news is 85% of halitosis or bad breath is caused or is oral, it is found in the oral cavity or in the mouth. The other 15% is in the other parts of the heart of the body, meaning the dentist can control or can help you 85% of this problem and can refer you to another physician for other procedures or other consultations. Let's go through the causes. Cause number one, cavities. We talked about tooth decay or dental cavities. You know the way how cavities are formed in the tooth. Sometimes people come when they are saying, I have a small cavity. This is because you see it as small. It can be seen small on top, but under or inside the tooth it's big. It is form of a triangle. In other words, on top it's small, down in the inside the tooth is what is big. It is formed according to what we call enamel rods, or the small particles of a tooth, how they move. So on top it seems small and down it is big. So as you keep eating food, it keeps on piling in the other holes. Other holes are obviously big. They will always have what? Food. But others can seem small when down it is what? It is really big. So the food keeps there, piling there, retaining there. You eat food today, tomorrow, the next day, it keeps piling. And bacteria, of course, will ferment this food and all types of food, and therefore will produce that fermented smell of foods which will be seen, or which will be heard, which will be noticed outside and smelled bad, what we call bad breath. So cavities, we shall talk about how to control them, how to treat them, but the dentist will help you to control this first point. That is number one. Another one is periodontal disease, or the diseases around the teeth. These include the diseases of the gum. Sometimes the gum gets sick to the point that you even fear to brush it, and always food sticks around there. You fear to brush. Sometimes there are wounds around there. All this will cause the gum to swell. All this will cause the gum to be tender or painful. Sometimes the gum can even have sometimes pus. Sometimes the gum can make the teeth shake, as we said before. This periodontal disease is a disease around the gum, which can even make the tooth come out without what? A tooth having a hole. So when we have periodontal disease or diseases around the gum, they can cause the gum to swell, they can cause the wounds around the tooth. This one will make you fail to brush well, and food will be retained there. Bacteria ferment this food, and you can even get pus around there, and the smell, of course, will be out there for the public, and this is what we call bad breath. Even when we are brushing our teeth, point number 3, there is we talked about for the runners, talked about papilla. The tongue is made up of papilla or something rough on it. The papillae, they are like how you see a towel. Usually when we brush our teeth, we need to clean this part, which is like a towel, with using a brush of the tongue, which should scrap off all the foods on the tongue. But normally we don't. So the coatings on the tongue will be always kept there and will retain, and we have a type of bacteria which is in the throat and the tongue, which can produce sulfur, and sulfur can always be brought out as bad breath in our bodies. So you should brush the tongue very well, because coatings around the tongue, it can be one of the causes of bad breath. Bad breath can also be, point number 4, caused by foods. Usually foods can also be another problem. Foods, for example, onions, those spiced foods. Sometimes foods can be foods, for example, onions. We can talk about foods, for example, garlic. Foods, for example, onions. All these can cause what? Bad breath. So it would be good for us to continue knowing that sometimes these foods can be, and we can see how to avoid them or brush very well after taking these foods. Another one can be medicine. You have noticed that when you take some medicines, for example, ampiclox, you shall feel you are urinating urine which smells like the smell of ampiclox. Your breath out, as you're breathing out, your breath is smelling ampiclox. So it can also be another cause of bad breath. We have another one, poorly cared for dentures. Dentures, they are very good because they are replacements of our teeth. But you need to make sure you care for these dentures as much as possible, because dentures can harbor food. Food can be retained under these dentures. When food is harbored there or retained under these dentures, it can be a cause of bad breath, because it's retained there. A bacteria in the mouth will obviously find it there and ferment it and bring out bad what? Bad breath. Another one is what we call dry mouth. We already talked about dry mouth. Dry mouth is what we call a condition where the body can produce little saliva. Little saliva, and we talked about saliva as a very important thing when it comes to reduction of tooth decay, because saliva sweeps away the remaining food from our mouth. So someone with the condition of dry mouth will always have this condition, because you know in we talked about, we have bacteria, the bacteria on the throat and on the tongue, which causes the sulfur producing breath, or which produces that smell of sulfur. So because these things are there, the bacteria is in the mouth and the food is not removed, it is always going to be called what? It's going to cause this problem. Apart from that, before we go to the other 15%, there is also a point where you find someone who has no bad breath. Do you know that you can be having no bad breath, but you have the fear to have the bad breath? And this one, we call it halitophobia. Halitophobia is another condition. You don't have bad breath, but for you, you fear. Maybe someone has checked you and has told you you have a bad breath, and you will fear always. There's also another condition called pseudo halitosis. You do not have halitosis, or you do not have bad breath at all. It doesn't exist in your body, but for you, you do what? You feel you have it. Maybe you had it before and it was done what? Cleared. But you do what? You have the pseudo halitosis. Or it is not there, but for you feel you have it. It is now the dentist to tell whether this is genuine or it is pseudo, or it doesn't what? Exist. Let's now go to extraoral causes, or the causes that are not outside the what? The mouth. Remember, we talked about cavities, we talked about periodontal disease, we talked about the tongue coatings, we talked about food, especially spiced foods, we talked about dry mouth, we talked about poor cared for dentures, we talked about medicine. But we can also have other diseases outside the oral cavity. These ones, a dentist may not treat them, but he can tell you that you need to consult maybe a physician in this department. For example, we have diabetes. Someone with diabetes will always have a fruity smell, like ketones. You know, there's so when you have diabetes, we have sugars which are not broken down well, and we shall have that incomplete breakdown of those sugars. We call them ketones, and can smell like a fruit, a fruity smell, which people with diabetes always get. So if you have diabetes, it can also be a cause of what? Bad breath. When you have kidney disease, these ones produce something like fishy smell. You need to see a physician or see a doctor to see if it is really the cause. If you have a liver disease shall always get sulfur smell. You also need to see a physician or a dentist to see if this is the what? The cause. Sometimes you have the problems in your stomach, in your digestive system, in your stomach. As you produce them, they come through the mouth and you feel what? A smell which is bad. You also have diseases of, for example, sinusitis. Sinusitis is also another cause of bad breath. Since the extraoral causes are there and intraoral causes are there, the good news, I said 85% are intraoral, or there can be those inside the mouth. So it is good for you to visit the dentist to tell you that this one is this side. This one I refer you to a physician, and this one I can control it from here. Now I request you to visit the dentist. He will tell you whether this is genuine, or this is halitophobia, or this is halitosis, which is pseudo, or refer you to the best physician. Thank you so much for watching. In the next video, we are going to look at how you can avoid the dental caries we talked about in the previous video, halitosis, which I talked about in this video, and how you can prevent all of them in our bodies. Thank you for watching. Please share, like, and subscribe.